Sir, thank you for giving your time.
Yeah, it's a privilege to address through Apollo platform. Shall we, without wasting time, shall we proceed further?
Neck pain can interfere with daily activities and reduce one's quality of life if left untreated. But neck pain is a general term, sir, which everybody will use in their common thing. Even a shoulder pain is called a neck pain for them. But in actual, what is the area involved in neck pain and what is its extent?
Yeah, it's a okay. To start with, you want me to define what is neck,
Yes.
extent of neck.
Yes.
So neck means in broad sense. If you talk at the front of the neck, the back of the neck, so next is a diffuse structure. But in terms of ortho and neuro considerations, so today we are discussing about cervical spine, in fact, the neck. So the neck extends from the back of the skull, that is occipital protuberance, from there to the C7 cervical spinous process, or the cervical hump, which we commonly see. The hump is nothing but the C7 spinous process, or a part of the vertebral, posterior part of the vertebral body. So the extent between the occipital protuberance to the C7 cervical spine is broadly defined as the neck of the cervical spines. So when we measure whether this fellow is having a short neck or a long neck, there are some short necks in some congenital anomalies. So we have to measure from the occipital protuberance to the C7 process, and we have to classify whether it is the neck is short neck or a long neck. So here we specifically confine ourselves to neck today. We will not go into the anterior lymph nodes and thyroid and all that, which are also a part of the neck. Even enlarged lymph nodes in the neck can also cause neck pain, swelling, fever, and all that. But we specifically focus onto the spinous part of the neck, that is the cervical spine today.
Sir, coming to the causes, what are the common causes causing this neck pain?
Neck pain, various causes are there, but if you classify them according to age, actually it will be much easy for anybody. So neck pain usually affects young grown adults and old adults, in old age people, and even in pediatric age group also. So depending upon the age group, we have to see the causes for the neck pain. So if you consider the young adults, the most common today is the reason for the neck pain is neck strain. It can be watching the text for a longer period, working on a system for a longer period. It's the most common cause for neck pain. Usually, this can be quite disturbing actually. After long working hours, you have severe neck pain in the night, and it can go into affect his daily life. In the same way, in a younger age group, long driving on uneven roads is one reason. And if you go to the village scenario, working with heavy loads on the heads carrying is also one cause of neck pain in the other areas. And because old age generally everybody like how the hair grays, even the spine also it degenerates. So degenerative conditions are most common reasons for the old age. And trauma, of course, it can affect anybody at any point of time, younger age or old age. Any motor vehicle accidents or simple falls also can cause neck pain, and definitely they will cause other sequel also. In younger age, if you see, infective pulse are one causes for neck pain, along with congenital disorders. There will be congenital fusion of vertebra, congenital dislocations of one vertebra or another, and infections which can affect the ligaments between two vertebrae and causing spinal instability, and that can also cause neck pain or the cervical spine pain. So depending on the age, the most common cause as a classified, if you take younger age, it can be a congenital cause or infective cause. Middle age is because of the regular straining. Suddenly one guy is starting in a gym with heavy load. Suddenly one guy travels on in a wrong position and sleeping in the wrong position, working in the wrong position, and also causing younger age. Old age, degenerative cervical spondylitis are more common causes. These are the causes broadly.
So usually incidence is more towards working young people, and then people who are
nowadays there's a lot of surge in these cases, especially younger software engineers and even any other people who spend most of the time in front of the systems. So That's because of one has to specifically correctly adjust the position of the working desktop or the laptop or whatever, even if it is writing, reading also. The cervical spine or the neck should not be overextended or it should not be too much flexed. So the neutral position is always of the spine is slight extension that has to be maintained. So it should be in level of one's comfort. One should not overbend your neck or overextend your neck. Both of these can cause spasm of the muscles, stretch of the muscles and ligaments, and they can then cause pain.
Coming to the presentation, how do the neck pain, how do they present and how do we diagnose them?
Most of the neck pain patients, they complain along with the history of a short journey or a strain during their office works or excessive work hours or a long travel on an uneven road or even a trauma sometimes, sometimes something falling on the neck or anything, putting more weights and doing lifting weights. And these can precipitate their symptoms. Usually they come with a history like that. They are usually normal only because that's what they say. That's one type of history. Some people have a chronic history. But one has to elicit is the pain confined to the neck or is it going to the shoulder? That's one thing. The other thing, one has to further question whether it's start in the neck or it's start in the shoulder. Starting in the neck going into the shoulder is different. Starting in the shoulder going into the neck is different. Most of the cervical spine problems they start in the neck and they can go to the shoulder. These pains will aggravate on neck movements, not shoulder movements. Any pain aggravating on a shoulder movement will be a pain pertaining to the shoulder, but a neck pain definitely arising from a cervical spine, a spinal pain definitely will be going into the ipsilateral or the contralateral, whatever it is nearby shoulder, depending upon the involvement of the roots. The left is involved predominantly or the right is involved predominantly. And whether the pain is localized to the neck or it is going into the shoulder, into the arm. If it is musculoskeletal pain, usually it will be localized to the neck. It will be aggravated by the movements of the neck. The movements of the neck means rotation of the neck, extension of the neck, flexion of the neck, lifting up, lifting down, looking sidewards. This can cause pain if there is muscle spasm. Irrespective of these movements, if there is a pain which is shooting from the shoulder into the arm, that means the root has been involved. If which side is involved, that root will be the distribution of the root will be painful. It will be going into the arm and into the forearm and to the hand. This can be associated with if there is more involvement, more pressure, paresthesias, tinglings, burning sensations, and all that. So neck pain, whether it's localized to the neck or whether it's localized to the ipsilateral shoulder, the opposite shoulder, or it is beyond the shoulder going into the arm. This is a classical basis of spinal involvement of the neck, spine, and the root and all that.
So, taking proper history will definitely bring a value to the diagnosis.
Definitely, if you spend 5 more minutes with the patient, definitely he will tell you the whole story. He will tell you the diagnosis. Right? Most of the, that's why by the kind of walk with which he comes into our clinic, we tell whether it's any compression of the spinal cord, whether it's confined only to the root or even the disc is also involved. The disc is pressing the cord. That is another scenario. So broadly, I'll classify. If you take the cervical spondylosis, is a broad word. So we'll take young people. The most common cause for neck pain is if you say disc collapse. Cervical disc collapse, the most common. In old age, it is cervical fascial joint arthritis and the spondylitic changes, which are age-related issues in the old age. But in younger, most commonly it is the cervical disc collapse. Most commonly seen at C5, 6 levels and C6, 7 levels. So involving the C6 root and the C7 root. So these patients classically present with the history which I told, pain confined to the neck, radiating to or traveling to one shoulder and to the arm. If the pain is associated with weakness of the lower limbs also, may not be both lower limbs, lower limb also, associated with the stiffness, that means the discompression not only involves the root, it also has compression of the spinal cord. So if the spinal cord is compressed at the level of C6, definitely the level below that will be spastic and stiff, and he'll have walking disturbances. And he can, if the level is a bit above, if they involve the intensive muscles of the hands, then he cannot do the daily activities of life like they have stiff hands. He cannot manipulate food, eat with a spoon. He cannot button and unbutton. So he needs some assistance. So these are the early symptoms which like of cervical myelopathy. Because some patients always may not start with cervical radiculopathy. They start with myelopathy itself. The central disc will cause with myelopathy also. These people will have vague pain. They go on vague pain for months, and suddenly they are present with stiffness of both upper limbs and lower limbs. Immediately you have to image them and you have to come to conclusion. So in young patients, what I told is there's a root pain which can present as a cervical radiculopathy. If the root is involved, it's called as radiculopathy. If the cord is involved, it's called as myelopathy. So both of them can be presentations, and one can diagnose very, very easily by just checking the history and just clinically examine them.
So coming to the investigations part, like how to evaluate these cases.
The half of the diagnosis will be done with the history and examination, madam. Sure. Then coming to the investigations for cervical spine, if there are persistent symptoms, the patient is complaining and if there is weakness of any specific movement, then definitely indicates some root is involved, or some kind of cord is being burst, or if there is spasticity and the tendon reflex are exaggerated, then these are the indications for imaging. You do not wait until the wasting continuously settles. So as early, if you diagnose early, if you can give treatment, these wastings can be reversed if they can be reversed early. So the main workhorse of cervical spine imaging is MRI cervical spine, which can give very, very good information about the cervical cord, the roots, and about the discs, and about the muscles around the cord. And if one want to go further about, and if there's especially there is a fall or there is a fracture, if you want to go more information about the bony segments, then a CT scan is also indicated. X-ray will give an information, an indirect information, definitely. It will give some information like any congenital anomalies or pre-existing fusion of the bones, or decreased disc space about the osteophytes. X-ray definitely will give some information, but as of now, the recent treatment methodologies, MRI definitely will give more information about the nerves and the soft tissues, and that should be followed with or without with the CT scan cervical spine. These are important, and sometimes there are some confused conditions. For example, patients will have definitely a sensory loss below the wrist. Okay, so there's a compression at the level of the wrist, and he also has a compression at the level of cervical spine. That is, for example, a C6. A C6 radiculopathy mimics carpal tunnel syndrome. So clinically, we may not always come to a conclusion because he will have both symptoms of radiculopathy as well as compression distally. This is called as mixed compression syndromes. So in this scenario, definitely nerve conduction tests will really come to help. A classical delay will tell you, okay, this is not C6 but this is pointing towards the carpal tunnels like that. So MRI along with CT blended with a nerve conduction test definitely will give a spot on diagnosis.
Sir, coming to the treatment part, any specific treatment do we have for this neck pain? So, like, how do we categorize patients and put them on treatment?
Patients with short history of neck pain who does not have any clinical localizing features like any wasting or pain pertaining to one root or one radical like that. There's no walking difficulty, there's no spasticity. We can treat these patients as musculoskeletal cervical spine disorders, musculoskeletal neck pain, and we can treat with analgesics, some muscle relaxants, and some soft collar which can support their neck muscles, and some tailoring of the workplace, lifestyle modification like weight reduction. We can manage these patients. Usually they respond to this type of conservative management. For patients who definitely have a disc, a mild disc, it's not really compressing the root, but there is a disc. In this case also we can try conservatively for 2 months, and we have to serially image them again and again depending upon the symptoms, and we have to see whether the disc extrusion has increased and its progression is worsening. Like that we can monitor with imaging. For some cases where the patient has a clinical symptom, he has a wasting, he has a severe excruciating pain, and the image shows there is a disc collapse, and the disc definitely cannot escape back inside. It is an extruded disc. The disc material has come out for a disc, and it has gone beyond its perimeter, and it is going into the root foramen space, and it is compressing the root and the cord. In these scenarios, definitely we have to definitely go into more intervention processes like surgery, or can be open or endoscopy. That should be followed by, once you do a cervical spine disc replacement, that should be followed by a disc replacement in the form of a cage or a new disc. It's a process. A lot of techniques are there, surgery with or without fixation and all that.
What is the usual prognosis for these kind of pains?
Early diagnosis, and if you can treat appropriately, especially cervical spine should be treated in a center where there is a very good system. Conservative, everybody can treat, but if you go to cervical spine surgery, these are the surgeries which definitely require very, very good surgical experience and good equipment and good magnification with the microscope. One need to have a very good operating microscope, very good micro instruments, patients, and need to have a lot of surgical drills to drill the bone and to cut the disc. And one has to clearly see the magnified image of the cervical cord, the disc, where is the impingement, and one has to release all that compression on table with the magnified image, followed by a process and fusion. Definitely, they have very good results. The progress will be very good if they are intervened early. Intervening lately, when the cord atrophy occurs, all the wasting has ensured, and all the spasticity has come, and there is already a bed sore in the patient, or already the total weakness. These people still have some good results, but not as the cases which we do intervene early. Most of the cases of cervical spine surgery, if there is wasting, that should be followed by physiotherapy. Even in the early cases, we can, for cases which are managed conservatively, neck strengthening exercise recommended by doctor, along with a physiotherapist, can be very, very useful. Unfortunately, there are some physiotherapy centers and some patients who directly go rush into a physiotherapist without imaging and all that. He tells the protocol, which will sometimes aggravate the already existing disc collapse. There will be an aggravated extrude disc that increases in its degree after a wrong movement. So always that should go along with the guidelines along of the doctor.
Post procedure or post surgery, or a patient who is under medical management, like what are the usual precautions they have to be taken?
As I told madam already, lifestyle modifications should be are very, very pivotal actually, because if there is a disc collapse at one level, there's always a chance of disc getting collapsed above and the below level, because a system usually will not affect only one part, it affect multiple parts. It may be silent at one point, but it may aggravate in the future days. So always, once you have to change your lifestyle, like the sitting position of and maintaining a proper position of your neck, which I told, it should not overbend and it should not overextend. A neutral position should be maintained. That's one thing. And multiple breaks in between of work, not in the same position. Just go take a break, walk, and again do some movements of the neck. I mean, obviously, when you walk, you'll see here and there, and the same movement will not be repeated. That will avoid spasm and degeneration. That's one thing. And people who travel frequently on irregular roads, they have a chance of a lot of movement of the cervical spine. So those people also should restrict their journeys on two-wheelers and try to follow some good roads. And in Indian scenario, it's quite unfortunate. We see a lot of these patients. Especially, we have seen a lot of RTC conductors who come, drivers and conductors who come with spondylotic lumbar sinus spine, because most of the chunk of their life has been spent in the bus on irregular roads and all that. And we see a lot of cervical spondylitis in tribal people who carry a lot of weight, that water pots, one pot or the other, and heavy loads of wood, firewood, which they carry. We have a couple of tribal areas nearby. So those type of things should be avoided, because our cervical spine is designed to carry only the weight of the head, and it has to do some movements, rotation of the head. It allows rotation of the head on that spine, and forward bending and lateral bending and back bending. Those are the movements it is designed for. It should not overdo it or overuse it by putting a weight on the head or trialing on the irregular road and things like that.
So, thank you so much, sir. What is the take-home message coming to you?
Cervical spine any cervical spine and neck pain, it has a lot of spectrum. It can be a mild musculoskeletal, small muscle sprain to a very severe complications, complicated scenario. Like if you neglect, it can cause weakness of both upper limbs and lower limbs also. So any bothering neck pain should not be treated at home or along with some friend suggestions or something in some Googling or WhatsApping like that. Consult a proper neurosurgeon or the patient, whatever it is you're comfortable with, preferably a neurosurgeon who has a reasonably very good experience with cervical spine surgeries and who see a lot of these spine cases. Take an expert opinion. Every case will not go for surgery. Take an opinion from him, then follow the precautions accordingly. Sometimes you may be missing a serious condition which could have been treated early. Then without you neglect that, and you end up in serious trouble, which will be devastating for your whole life. So that's very, very important. So always don't just take sort of neck pain in a very easy way. It can be very, very simple reason cause of neck pain, and it can have serious consequences. So visiting a doctor, a professional neurosurgeon, really go a long way.
So all neck pains are not the same.
Definitely, all neck pains are not simple, or non-neck pains are not complicated. So it depends on case to case. All that. Neck pains in children also should not be neglected, because usually mostly they'll follow children, they'll play, they'll have neck pains. People will neglect recurrent neck pain, especially with wasting or weakness. Neck pain, especially with headaches in children, should be evaluated.
So, I invite everyone who is in the chat if there are any questions. Any questions?
Yeah, we welcome any questions, sir. Questions or any queries like.
Hello.
Any queries or questions?
Chat note. Questions are there?
Yes. We'll wait for 5 more minutes to have any questions. If at all we have any, you're welcome to ask service. Any questions from anyone, please? So we have one question from Mr. Ravi. He says neck pain on right side. Can you specify the question?
Neck is in the midline. How the neck pain? I mean, it's more onto the right shoulder. Is talking about.
Do If you can specify us on your question, we can answer the question, Mr. Reddy. So we have question asking about management of cervical stenosis.
Cervical canal stenosis is a condition where the normal canal gets stenosed. Stenosed canal will cause compression of the cord. If there is a single level stenosis because of a disc collapse, we can operate from the front. If there is a single two-level stenosis, we can still operate from the front. That's called the anterior cervical spine surgeries. If there's more than two-level spinal stenosis, we have to operate from the back. That is called as a laminectomy. We have to do a wide laminectomy. Cervical canal stenosis is usually present with more than 2 levels, 2 levels or 3 levels. In the old age, especially with the spondylating spine, pre-existing spine. Spinal cord tumors also will present with neck pain. We actually thought of mentioning that actually in younger age. One has to keep in mind all the imaging of MRI will elicit all those things along with the disc collapse and all that.